Thank you, Mr. Chair and members. And I'd like to begin just by saying I accept the committee's amendments and am appreciative of the staff for working with us to make improvements on the bill. We're all aware of the crisis facing abortion rights in America at this time. I am passionate about bringing to light the issue of deception that constituents in all of our districts encounter at a critical time when they're faced with a very difficult decision, something personal to them, to their bodies, and to their health. Across California, crisis pregnancy centers outnumber abortion clinics by 20%. These clinics use deceptive practices targeted at vulnerable populations to draw them in by claiming they provide abortion services when they have no equipment nor capacity to provide abortions. These crisis pregnancy centers shame, intentionally mislead, and lie to women about their reproductive health care options to block them from accessing abortion care, and are confusing a lot of people in our community. As a nurse advocate who worked with nurses on ensuring safe access to health care, I see it as extremely dangerous that these fake pregnancy centers present themselves as medical clinics. To be clear, they are not licensed medical clinics. While women are in their most vulnerable state, working to get reliable medical information and possibly referrals for or abortion care, they instead are met with shaming and fear tactics and fed misinformation about abortions, leading to infertility, depression, and higher suicide rates. All misinformation. AB 710 will deliver accurate information about how these fake women's healthcare centers operate and what options are available for people. This legislation would prompt the launch of a public awareness campaign to communicate the facts about actual pregnancy care and abortion services being provided at primary care and specialty clinics. When women need to access health care, it's critical the information they get is factual and that the providers have your best interest in mind. Not an agenda to discourage you from seeking abortion care. With AB 710, factual information will be delivered to the general public as well as those in the healthcare space to ensure anyone seeking abortion care would know where they can get medically accurate, comprehensive, and unbiased information. Timely reproductive health care is essential and must be met without delay. The delay that these fake healthcare centers can impede a pregnant person from making the choices that's best in their families and their healthcare needs. Rest assured, California will continue to lead by protecting women's healthcare, including abortion care. I have with me today as witnesses Shannon Hovis, Director of NARAL Pro-Choice California, and Dr. Kelly Pfeiffer, Executive Director of ARIA Medical. Thank you.
Good afternoon, Chair and members. My name is Shannon Olivieri-Hovis, and I'm the Director of NARAL Pro-Choice California, representing NARAL's 4 million members nationally who are fighting for reproductive freedom. Reproductive freedom means that every individual has the ability to make personal decisions about their reproductive lives, free from government interference, and free from any form of oppression or coercion. California law strongly protects reproductive freedom, including the right to access birth control, abortion care, prenatal care, and more. And since the Supreme Court overturned Roe v. Wade nearly 1 year ago, California has taken additional steps to ensure that Californians and those forced to travel here understand their legal rights to access abortion care, including by creating abortion.ca.gov. But the reality is that California must do more to ensure that all communities, including immigrants, LGBTQ+, foster youth, people experiencing homelessness, and more, have access to medically accurate and comprehensive information about services available, abortion services in particular, available in our state. Fake health centers, sometimes called crisis pregnancy centers, threaten reproductive freedom and prey upon our most vulnerable communities, frequently targeting people of color and pregnant people with low incomes. Fake health centers are run by anti-choice organizations that intentionally lie to, shame, and mislead pregnant people seeking an abortion in order to block them from accessing care. These groups provide few or no real medical services, mislead people about the services they do provide, exaggerate the likelihood of miscarriage in early pregnancy to downplay the urgency in seeking abortion care, push health disinformation, like emphasizing non-factual relationships between abortion and infertility, as well as breast cancer, to dissuade pregnant people from accessing abortion, and have been shown to delay access to medically legitimate prenatal and abortion care. Alarmingly, as Assemblymember Schiavo said, the number of fake health centers in California is 20% higher than the number of health centers that provide abortion. Everybody deserves to have access to the medically accurate, comprehensive, and unbiased information they need to make personal decisions about their lives. AB 710 will complement abortion.ca.gov by establishing a public awareness campaign to communicate the facts about pregnancy care and abortion services being provided at primary and specialty clinics in California. This bill reflects one of the recommendations of the California Future of Abortion Council, and I urge your aye vote. Thank you.
Thank you. I'm Dr. Kelly Pfeiffer. I've been an abortion provider for over 25 years, and I currently practice in rural California, Arizona, and Kansas, and I recently started a medication abortion clinic in Kansas. Every day, I see people who've been harmed by these fake clinics. Many patients are made to go through later, more complex procedures because they went to a fake clinic thinking they'd get the abortion pill. They're told they're too early to come back repeatedly, and then they are too late. In any other part of medicine, when I get a test result from another doctor or clinic, I trust it. When I get an ultrasound from one of these clinics, I have to repeat it because we've had cases where people have been given the wrong image to be convinced that they're too far along when they're really too early, or when they're convinced they're much earlier just to run out of time. Always to make sure that you can waste time until someone no longer has that option. My patients have no idea that their information is not private, that these are not real medical clinics, and that people can share their private data with whomever they want. I see teenagers who would be profoundly harmed if their families found out they are pregnant, and these centers have no obligation of confidentiality. I see patients weeping because they fear they will never be able to have a baby again, that they're going to get cancer, that they're going to get some terrible things that they've been told, and they're desperate to have their abortion. They come anyway, but they're terrified of what they're doing to themselves. All of these things that they walked out of this clinic believing they were true, but they are not true. In any other part of the healthcare system, this would be inconceivable. Can you imagine going into a cardiologist and be given a fake result to convince you that you're about to have a heart attack to trick you into surgery? This happened in Redding, California. It was criminal and it was shut down. But in fake clinics, people get this information that affects them profoundly, false information, and there are no consequences. Californians deserve to be informed. They have the right to medical care without being tricked. I urge you to support AB 710, and thank you for inviting me today.
Thank you. Others in support?
Good afternoon, members and committee members. Mari Lopez with California Nurses Association in support.
Thank you.
Chair and members, Erin Evans on behalf of the California Nurse Midwives Association in support.
Thank you.
Good afternoon, Molly Robeson with Planned Parenthood Affiliates of California in support.
Thank you.
Good afternoon, Ryan Souza on behalf of Essential Access Health in support.
Thank you.
Veronica Villalobos with the California Latinas for Reproductive Justice in support. Thank you.
Thank you.
Dr. Taiwo, midwife with Black Women for Wellness and Black Women for Wellness Action Project, strongly in support of this bill.
Thank you. Is there opposition to the bill? Please come on up.
Mr. Chair and members of the committee, it is an honor to be before you today. Hello, my name is Heidi Matzke, and I'm the Executive Director of Alternatives Pregnancy Center in Sacramento. I oppose AB 710, a bill that defames and falsely accuses licensed medical clinics like ours. This bill has defined in the fact sheet also seeks to derail women's access to comprehensive health care provided through pregnancy centers like ours. At Alternatives Pregnancy Center, underprivileged women receive pregnancy tests, ultrasounds, prenatal care, full-service gynecological care and treatment, abortion pill reversal services, and post-abortive care. At no charge, nearly $1.5 million worth last year. Our website, signage, and phone personnel clearly state that we do not perform or refer for abortion, and instead we provide unbiased, peer-reviewed education on abortion procedures so women can make informed choices regarding their pregnancies and their reproductive health. The doctors, nurses, nurse practitioners, medical assistants, and phlebotomists at Alternatives are all licensed medical professionals. Many have experienced or performed abortion in their past and are compelled to help others. Atoria is a patient of Alternatives who is faced with domestic abuse, homelessness, and an unplanned pregnancy, only to be handed the abortion pill as Planned Parenthood's only option. Instead, at Alternatives Pregnancy Center, Atoria was provided abortion pill reversal services, prenatal care for her healthy baby, financial support, housing support, and emotional support. Shannon is one of 177 women in the last 2 years who was denied care at Planned Parenthood because they would not choose an abortion and then came to Alternatives for comprehensive medical care. Kelly was told by Planned Parenthood that abortion was her only option, but was never educated on the different procedures or how they would impact her long term. They provided her with 5 abortions, and it was years before she found healing through post-abortive classes offered for free at Alternatives Pregnancy Center. Ariane was pregnant, struggling with addiction and homelessness. Alternatives provided comprehensive care and housing for her. Now she has a healthy daughter, has recovered from her addictions, and is mentoring other women. After living as a man, choosing to detransition, Jess sought us out, a place that wouldn't shame her, but instead provided the gynecological care she needed as a woman. Would the medical team and staff of Alternatives Pregnancy Center please stand right now? Who was there for these women who needed comprehensive medical care? Who was there when they wanted to practice their full right to choose? Alternatives Pregnancy Center was the licensed medical facility that was there for every one of them, as many pregnancy centers throughout California are. I am grateful for our God who has made the work of Alternatives possible, for we love because he first loved us. Now that the facts and the truth have been presented, you must recognize that this bill seeks to discredit the very facilities that women deserve to have access to. So I'm asking you to respectfully oppose AB 710.
Okay, thank you. Please, no applause, and we don't, no expressions one way or the other. No applause, no boos, no anything. So thank you. Next witness, please.
My name is Atoria Foley, mother of a daughter born after 2 successful abortion pill reversals. I stand here today in full opposition of Bill AB 710. AB 710's manipulative verbiage begins with describing pregnancy care clinics as fake, intentionally misleading, even going far enough to state that pregnancy care centers shame pregnant women. In all actuality, I would describe my experiences with Planned Parenthood as fake, shameful, and intentionally misleading. AB 710 also claims that those seeking abortion services are derailed by the number of pregnancy centers in California. Yet here in downtown Sacramento, 2 Planned Parenthood locations sit a mere 8 minutes apart. There is no shortage of abortion accessibility in California. As a result of the openly biased and disprovable statements used in Schiavo's summary of AB 710, the deceptive nature behind this bill is revealed, immediately refuting the claim that, quote, accurate and unbiased information would be distributed through this campaign. Instead, what AB 710 will accomplish is the intentional swaying of a vulnerable population of women and men towards seeking abortion services through limited and biased information, misinformation that holds the power to end the life of an unborn baby, a child whose life may be preserved if their mother has full access to comprehensive medical care, as I received at Alternatives Pregnancy Center, and truths regarding abortion. Truth such as the validity behind abortion pill reversals. Truth that a reversal does not harm a developing baby. Truth that my daughter is a living testament to after 2 attempted abortions and 2 successful reversals within 1 pregnancy. A truth that AB 710 seeks to silence. It is absolutely crucial that people receive unbiased care and information when considering abortion, including information about reversals. At Planned Parenthood, I did not receive that. As I sat in fear and regret, asking how to reverse my abortion, I was told that I safely could not. That was a lie. I found myself repeatedly apologizing to the nurse as she increasingly grew in her annoyance. Annoyance at my hesitancy, annoyance at my tears, annoyance about my questions about abortion pill reversal. I look back on myself that day and I am saddened at who I was. I was scared, sad, lost, and afraid to speak up for myself. But I am no longer that version of myself today, and today I will not be afraid to speak up. I will speak up for women in my past shoes. I will speak up for God, the author of life, to speak up for those who cannot yet speak for themselves. Lastly, I will speak up for what is wrong, and AB 710 is deceitfully, intentionally wrong. It is my hope that you will speak up and stand with me in opposition. Thank you.
Okay, thank you. Are there others in opposition? So just your name and organization if you represent one.
Sophia Laurie with Young Women for America, California Family Council, and relative to a woman who was lied to by Planned Parenthood in
just
opposition.
Your name and position, please.
Pastor Brandon Campbell with the California Capital Connection for Independent Baptist Churches in opposition.
Thank you.
Shannon Gale, I'm a mother, and I'm in strong opposition.
Thank you.
Susan Gosselin, I'm a nurse practitioner at Alternative Pregnancy Center, and I strongly oppose.
Thank you.
Hi, I'm Jess Rose. I was born a woman, transitioned to male, and identify now as a woman, and I oppose this bill.
Thank you.
Ariane Clark, resident of California and a mother. I oppose this bill.
Thank you.
Lisa Eichinger, Alternatives Pregnancy Center. I strongly oppose this bill.
Thank you.
Alina Vankova, a Sac State student, and I oppose this bill.
Thank you.
Diana with Alternatives Pregnancy Center as a licensed phlebotomist, and I strongly oppose this bill.
Thank you.
Rebecca Lathrop with Alternatives Pregnancy Center, and I oppose this bill.
Thank you.
Nellie Vasilkov with City Bible, and I oppose this bill.
Thank you.
Nikki Detner, and I oppose this bill.
Thank you.
Oksana Pisareva, registered nurse, strongly oppose this bill.
Thank you.
Starlene Bellamide, a phlebotomist and mother of 5, I oppose this bill.
Okay, thank you.
Dr. N. Almanti, OBGYN, I strongly oppose this bill. I'm a medical director of Alternative Pregnancy Center.
Thank you.
Rainy Day Garcia, Alternatives Pregnancy Center, and I oppose this bill.
Thank you.
Hello, committee. My name is Robert Bird. I'm a Bay Area resident, political independent, and I urge you to vote no on this bill.
Thank you.
Thank you, Chair and members. My name is Jonathan Keller, President of California Family Alliance, also speaking on behalf of the California Southern Baptist Convention and their 2,000 churches respectfully opposing the bill.
Thank you.
Ann Bradeen, representing 40 Days for Life, and I strongly oppose this bill.
Thank you.
Kelly Bradford, multiple post-abortive woman, and I oppose this bill.
I'm Olga Herman, Reverend Olga Herman. I'm with JC Resource Center, and I represent Life Teams and the Prayer Council of the United States, and I oppose this bill, please.
Thank you.
Greg Burt with the California Family Council in strong opposition. Thanks.
Thank you.
Amy Scherschlicht, volunteer at Sierra Pregnancy Plus Health in Roseville, and I strongly oppose this bill.
Thank you.
J.C. Carpenter, and I am a founder of Life Love, leader with 40 Days for Life, and 3-time post-abortive woman. I staunchly oppose this bill.
Thank you.
Bob Simmons with Alternatives and adoptive father. I strongly oppose your bill.
Thank you.
Dr. Vanson Wong, OBGYN, in opposition to this bill.
Thank you.
Jackie, the street preacher of Kingdom Roar, and I strongly oppose this bill as an adopted daughter.
Thank you. Anyone else?
Clifton Billings, 74-year-old Vietnam veteran, former FDA microbiologist. I strongly oppose this bill.
Thank you. Okay. Seeing no one else, we'll bring it back to the committee. Questions or comments? Dr. Weber.
Thank you to the author and to the opposition and to the supporters. I actually had not planned on speaking on this bill, but the statements from the opposition has compelled me to speak and to ask a few questions. Are your physicians board certified and members of ACOG?
Yes, they are.
So do you align your principles and policies with the American College of Obstetrician and Gynecologists?
Our policies and procedures, I would have to ask them for that.
Okay. Well, I'm looking at them in the audience, and they're not saying anything. So what randomized control trials have validated the abortion pill reversal services?
I don't know that there has been. I know that the FDA, there was a trial that was being done in Southern California, but I don't know how that trial ended. What I do know is for the last 4 years, Alternatives Pregnancy Center has been doing abortion pill reversal services, and there have been at least 100 women who have had babies as a result of it.
Have you put those into actual, like a paper or an article or peer review so that it could be evaluated?
No, I have not.
All right. And the reason why I ask is you've said a lot about abortion pill reversal services. There was testimony that was very moving about the fact that you had not been counseled on that as a possibility. And I am an OBGYN and a member of ACOG, and I'm board certified. And ACOG states facts are important, which is true. Medication abortion reversal is not supported by science. Facts are important, especially when it comes to policies and discussions that impact patients. Claims regarding abortion reversal treatments are not based on science and do not meet clinical standards. The American College of Obstetrician and Gynecologists ranks its recommendation on the strength of evidence and does not support prescribing progesterone to stop medication abortion. A 2012 case series reported on 6 women who took mifepristone and were then administered varying doses of progesterone. 4 continued their pregnancies. This is not scientific evidence that progesterone resulted in the continuation of those pregnancies. These case control series with no control groups are among the weakest form of medical evidence. So,
can I ask a question?
A 2020 study intending to evaluate medication abortion reversal in a controlled IRB, because the initial one was not IRB approved. The initial one that had 6 people, the study was not supervised by an institutional review board, IRB, or an ethical review committee required to protect human research subjects, raising serious questions regarding the ethics and scientific validity of those results in 2012. So a 2020 study intending to evaluate medication abortion reversal in a controlled IRB approved setting, that's probably what you were referring to a couple of years ago, was ended early due to safety concerns among the participants. So I ask if your practitioners are members of ACOG, are board certified, and align their policies with ACOG, because this is important. If patients are coming to you or your facilities, wherever they may be, in a very vulnerable state, right? Pregnancy, sometimes it's a surprise for people. There's a lot of different emotions going on. It's extremely important that they are counseled properly on medically found information.
As an OBGYN doctor, what would make you not want to allow a woman to have a second chance at life to save her baby, as that has happened time and time and time again at Alternatives?
As a physician, all physicians want to save lives.
Mm.
That is what we go to medical school for.
So why would you be in opposition to what we are doing?
This is not a back and forth.
Right. So that is what we go to medical school for. That is what we do our residencies for. And for those of us who go on, like myself, to do a fellowship, to do extra training, that's what we do it for. We all want to save life. But we also know that we have to provide correct information and not factual information. So, you know, I wholeheartedly support your bill. I was not going to speak today, but learning what is being put off as factual information is very concerning and very disappointing, not only as an OBGYN, but as a woman and a mother of 2 children. If I went to one of your centers and was given this factually, medically incorrect information, I would be very upset. Thank you.
Thank you. Anyone else? Mr. Patterson?
Thank you. First, I want to say I have a great deal of personal respect for the author of this bill, and I did warn her last night that I have a different perspective on this particular topic. I want to thank the moms and the beneficiaries of these services and the medical professionals that are here. Because of conversations like this, I think crisis pregnancy centers have wrongly been targeted for violence. These centers have had to shut down because of security concerns. I'm thankful for these centers. I'm not a scientist. I can't really debate the reversal medication situation. I really don't know. All I know is I've met a lot of these women and these families that have benefited from their services, and I take complete offense to calling them fake health centers. I take offense to you calling the licensed doctors, the nurses, and other medical professionals as fake. The women who had abortions and have gone through these centers and have used services of Planned Parenthood and the crisis pregnancy centers in attacking them is not appropriate. It's false. They cannot provide data with whomever they want. Just heard a bill in privacy just now where I serve as the vice chairman, and there's actually legislation up right now to make California's already strong privacy laws that are landmark legislation even stronger to protect women who are coming in from out of state and deciding to have an abortion here. And so it's not accurate to say that they can share personal information, and if they're doing that, that's a violation of already existing law. You just described an example of a situation in Reading. I don't know anything about it. I tried to Google it, couldn't find anything about it, but let's assume it's true. And it sounds like to me if it was shut down that the law took care of it. There are bad actors in a lot of fields of study, a lot of different kinds of situations, and I'm not going to paint a broad brush, but very soon I'm going to an event in my district with literally hundreds of families that are going to be supporters of one of these centers in my district. And it isn't because they're fake. It's because they're actually benefiting my community and women who've benefited from this service. And so I wrote my comments as I was sitting here listening to this because I think the mischaracterization of these centers throughout the country has been really problematic to me. I've seen what they've done. I've seen the women who've benefited from them. And if we want to have a discussion about the types of things that they can do, I think that that's fine. But giving this legislation, in my opinion, paints them with a broad brush. And I definitely cannot support this legislation as a result.
Thank you. Anyone else? See no one. We have a motion by Assemblymember Aguirre-Curry, a second by Dr. Weber. The motion is to pass as amended to appropriations. Would you like to close? You're still off.
It's like blinking at me.
It's
okay.
blinking. Okay.
I'm not touching it, and it's working. Yes? Okay. So thank you so much, Chair and members, and appreciate everyone's comments today and insights. I think, the Alternatives Pregnancy Center is not the norm. It is the exception. They are actually medically licensed, but it is rare and the majority of them are not. And as we've heard today, even in the case of a licensed center, they're not providing medically accurate or factual information to people, even when they are here in front of a legislative body. I'm glad I didn't wear pink today, because we all know that's what abortion rights activists have been wearing, and even visually confusing people. And I think it's emblematic of what's happening within these centers. This is simply a public information campaign. This is not restricting them in any way. It is making sure that anyone who is pregnant knows where they can get certain kinds of information. If they want factual information, medically based information about abortion, they should know where they can get it. Right now, I happen to have the website from the Alternatives Pregnancy Center, and this is what you find on their website, which talks about abortion. These are questions to ask yourself. Is abortion the right decision for me? Would I consider parenting or adoption? Will I regret having an abortion? Do I have a strong personal or religious belief about abortion? Would my family, friends, and partner support me in this decision? Am I feeling pressured to have an abortion? Would having an abortion change my life in a negative way? Would I receive the support I need if I decided to parent a child? Now, I would not say that this is comprehensive of abortion information when people are seeking information about abortions. And this is on their website. They're not even hiding this. So we are just suggesting and moving forward the idea that we need to make sure that people know solid information when it comes to what their options are around abortion. If people want to keep their children and they provide the kinds of services they're talking about, that they want to keep that baby, fine. That's great. That's wonderful. And that should be clear. But it is not a place where you get a referral for abortion or real medical advice around abortion options. And that should also be clear. We should make it clear where you can get that information. So when people are at this moment, when it is so hard, when it is such a difficult moment for people, to go and be shamed and confused and misled at that vulnerable moment, to me is unconscionable. As a mom who, I have 2 daughters, and I'm very happy that I was able to choose when I had a baby at a time where I could support my daughter. And I think that everyone needs to be able to make that decision on their own without pressure and shame and embarrassment. This is simply public information. And if what you're doing you're proud of, this should not scare anyone, and there should not be opposition to it. I respectfully ask for your aye vote. Thank you.
Thank you, Ms. Schiavo. The motion is do pass as amended to appropriations. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Waldron?
No.
Waldron, no. Agar Curry? Agar Curry, aye. Arambula? Berner? Wendy Carrillo? Flora? Vince Vaughn? Mainshine? McCarty? Joe Patterson? Joe Patterson, no. Rodriguez? Santiago? Villapudois? Weber? Weber, aye.
It's 3-2. We'll leave the bill on call. Thank you very much. You have a second. You have an AJR